If you wake up in the morning with your heart pounding like a drum, a sudden spike in your blood pressure, or an overwhelming wave of unexplainable anxiety before your feet even touch the floor, I need to tell you something critical. Your heart is not defective, and you are not just getting stressed with age. Right now, your body's master brake pedal is mechanically jammed. Most people are prescribed higher doses of blood pressure medications or told to take calming supplements. But while pills can temporarily force your vessels to dilate, they do absolutely nothing to release the physical, structural pinch strangling the main nerve that controls your resting heart rate and arterial pressure every single night, running directly from your brainstem down through your neck, heart, lungs, and digestive tract, is the longest and most powerful cranial nerve in the human body, the vagus nerve. In clinical cardiology and neurology, we call the vagus nerve the master conductor of your parasympathetic nervous system. It is the only physical wire in your body capable of instantly slowing your pulse and dropping vascular resistance. Before the vagus nerve reaches your chest, it must exit the skull through a microscopic bony gateway called the jugular foramen, passing right next to your first cervical vertebra, the atlas bone. When you sleep on a thick, stiff pillow or have accumulated decades of forward head posture, the suboccipital muscles clamp down like an iron vise, directly compressing the vagal nerve bundle against the bone. The moment this nerve is compressed, your internal brake pedal fails. Your sympathetic fight or flight system runs completely unchecked throughout the early morning hours. Your adrenal glands dump norepinephrine, your coronary vessels narrow, your resting heart rate jumps by 15 to 25 beats per minute, and you wake up feeling wired, exhausted, and dizzy. Groundbreaking neurological research by Dr. Stephen Porges and autonomic specialists has revealed that the vagus nerve is not just a passive sensor. It contains specialized motor fibers that regulate your heart's sinoatrial node. Stimulating the superficial sensory branches of this nerve immediately triggers a systemic release of acetylcholine, signaling every muscle cell in your arterial walls to relax within 60 seconds. Before we fix it, let's perform a simple 10-second self-diagnostic. Take your pointer finger and gently press the cartilage flap just inside your ear canal, the tragus, and the hollow groove directly behind your jawbone below the earlobe. If pressing these spots feels unusually tender, sharp, or triggers an instant urge to swallow or clear your throat, your vagus nerve is chronically irritated. This compression doesn't only manifest as a racing pulse. It is the primary hidden root cause behind chronic morning throat clearing, sudden esophageal reflux, unexplained eye twitching, cold hands upon waking, and that frustrating morning brain fog where thinking clearly feels like wading through thick mud. Many people are told, just take deep breaths. But if you inhale rapidly through your mouth or flare your chest, you actually trigger more sympathetic overdrive, hyperventilating your lungs and worsening the arterial constriction. To truly reboot the vagus nerve, you need a precise, physical decompression sequence that mechanical resets the cranial base. Right now, I am going to teach you the 2-minute bedside vagus nerve reset. This is a gentle, zero-impact physical protocol designed specifically for adults over 50. You can perform it sitting upright in bed the exact moment you wake up, without any tools, bands, or medications. Let's begin with Step 1. Step 1 is the auricular vagal acupressure. Your outer ear is the only place on the entire human body where the sensory branch of the vagus nerve reaches the surface of your skin. Place the pads of your index fingers inside the inner hollow of both ears, resting against the Concha just above your ear canal. Apply gentle, steady circular pressure for 20 seconds. As you perform these small rhythmic circles, breathe slowly through your nose. Within 15 seconds, you will feel a distinctive reflex, a spontaneous deep breath, a softening of tension in your throat, or a sudden moistening of your mouth. This is the physiological sign that acetylcholine has just flooded your bloodstream, sending a direct braking command to your cardiac pacemaker. Step 2 is the suboccipital eye movement reset, based on the basic exercise developed by Stanley Rosenberg. Interlace your fingers and place them behind the base of your skull, supporting your head with your spine upright. Keep your head facing strictly forward, and without moving your neck, shift your eyes as far to the right as comfortably possible. Hold your gaze fixed to the right for 30 seconds. Keep breathing steadily. The suboccipital muscles behind C1 and C2 are neurologically wired to your cranial eye motor nerves. As your eye muscles sustain this position, the tight neck muscles reflexively release their grip. Wait until you experience a spontaneous sigh, yawn, or swallow, then smoothly shift your eyes to the left for 30 seconds. Step 3 is the sternocleidomastoid gentle glide. The vagus nerve travels downward inside your carotid sheath, directly underneath the large muscle that runs from your collarbone to the base of your skull behind your ear. Turn your head slightly to the left, and with 2 fingers, gently glide downward along the front edge of the neck muscle toward your collarbone. Never press hard or push inward against the throat. This is a light, sweeping skin glide repeated 5 times on each side. It relieves facial venous congestion, drains stagnant lymphatic fluid from the head, and removes fascial restrictions around the internal jugular vein and vagal trunk, instantly restoring smooth nerve conduction down into your chest. Step 4 is the 4-7-8 parasympathetic lock. Place one hand flat over your upper chest and the other hand over your lower abdomen. Inhale quietly through your nose for a count of 4 seconds, expanding your belly. Hold that breath gently for 7 seconds, and then exhale slowly through pursed lips with a soft whoosh sound for a full 8 seconds. When your exhalation is twice as long as your inhalation, the pressure receptors in your carotid sinus and aortic arch, known as baroreceptors, send an urgent electrical signal to your brainstem. The body is completely safe. Your vagal tone surges, your peripheral blood vessels dilate, and your systolic blood pressure begins dropping immediately. Step 5 is the mammalian diver's reset. If you wake up with particularly intense palpitations or high morning anxiety, take a cool, damp washcloth or splash cool water across your forehead, temples, and upper cheeks for 10 seconds. This activates the trigeminal vagal reflex, triggering an ancient evolutionary survival mechanism that instantly slows heart rate by up to 20%. Why is doing this first thing in the morning so crucial? Clinical studies show that over 65% of all adverse cardiovascular events occur between 6 a.m. and 9 a.m. This is when your natural cortisol awakening response peaks. By applying this 2-minute reset while still seated in bed, you neutralize that morning adrenaline surge before it can damage your blood vessels. To prevent night after night nerve pinching, examine how your neck rests while you sleep. If your pillow is too thick, it forces your chin down toward your chest, bending the atlas vertebra forward and crushing the jugular foramen for 8 continuous hours. Use a supportive, contouring cervical pillow that keeps your ears, shoulders, and hips in one neutral horizontal line. Did you know that 80% of your vagus nerve fibers are actually sensory signals traveling upward from your gut to your brain? When your vagus nerve is healthy and decompressed, it stimulates stomach acid production, regulates bile flow, and activates intestinal peristalsis. Within just 3 days of this routine, chronic morning bloating, nausea, and indigestion dramatically improve. Here's what you can expect when you make this your daily morning habit. On day 1, your morning pulse drops to a calm, steady rhythm, and feelings of dread vanish within minutes. By day 3, your morning blood pressure readings stabilize with fewer dramatic spikes. By day 7, deep sleep quality improves, your neck feels free of stiffness, and your daytime energy remains steady all afternoon. A crucial warning: never violently twist, crack, or aggressively massage your neck, and never press hard on both sides of your throat simultaneously. The carotid sinus is extremely sensitive, and aggressive force can cause a sudden dizzy spell. Keep all touches gentle, rhythmic, and relaxing. Consistency matters far more than force. This protocol is 100% safe for seniors, individuals with pacemakers, those managing high blood pressure, and anyone suffering from chronic neck arthritis. Because it relies on gentle surface acupressure, neurological eye shifts, and measured breathing, there is zero strain on your spine, joints, or cardiovascular system. In addition to heart health, stimulating your vagus nerve triggers the cholinergic anti-inflammatory pathway. It signals your spleen and immune cells to halt the overproduction of inflammatory cytokines like TNF-alpha and IL-6, helping calm systemic joint aches, chronic fatigue, and full body stiffness throughout the day. Here is your simple daily action plan. Every single morning, before checking your smartphone or stepping out of bed, sit upright against your pillows and spend exactly 2 minutes performing these 5 steps. Repeat the auricular ear pressure again in the evening right before turning off the lights to guarantee deep, restorative sleep. Let's recap your 2-minute sequence. First, 20 seconds of circular ear pressure on the concha. Second, 30 seconds of eye shifts to the right and left until you sigh. Third, gentle downward neck sweeps along the SCM muscle. Fourth, 3 rounds of 4, 7, 8 breathing. And fifth, a cool splash of water to seal your parasympathetic tone. True longevity and cardiovascular health are not about fighting your body with endless medications. They are about giving your autonomic nervous system the mechanical freedom to do what it was designed to do: protect, heal, and keep your heart beating calmly for decades to come. If this protocol brought a sense of calm and relief to your chest and neck today, please hit the like button and share this video with a loved one who struggles with high morning blood pressure or morning anxiety. Subscribe to Dr. Alex Morgan Longevity Clinic and leave a comment below sharing your morning pulse before and after this reset. I read every single comment. Stay healthy, and I will see you in the next video.